Hemothorax. A hemothorax is a condition that results from blood accumulating in the pleural cavity. The buildup of the volume of blood in pleural space can eventually cause the lung to collapse as the blood pushes on the outside of the lung. Hemothorax often occurs with pneumothorax, which is excess air in the pleural cavity. Causes. The most common cause is a traumatic injury to the chest, such as a puncture wound or blunt force injury. Even the smallest injuries to the chest wall or lungs can lead to hemothorax. A hemothorax can also result without any trauma, and in these situations, it is termed as a spontaneous or iatrogenic hemothorax. Other causes include defect in blood clotting, chest surgery, death of lung tissue, lung infections, lung or pleural metastasis. Hemothorax can also be caused by a medical procedure such as placement of subclavian or jugular catheters or lung and pleural biopsies. Another problem that can result from a trauma to the chest is pneumothorax. In this case, air collects in the chest cavity. If a person has both, this is called Haemoneumothorax. Pathophysiology. There are two layers of pleura, one of which covers the lung surface and the other the inside of the chest wall. If air or fluid enters the pleural cavity in between these layers of pleura, it causes the lung to collapse. If it is only air entering the pleural cavity, it causes a pneumothorax. If it is fluid or blood entering the pleural cavity, it could cause a pleural effusion or hemothorax. Trauma or injury to the chest results in rupture of visceral and parietal layers, which allows the blood to spill into the pleural space, leading to hemothorax. Types: traumatic hemothorax due to penetrating or blunt trauma or traumatic injury to the chest, iatrogenic hemothorax due to complications of chest procedures, spontaneous hemothorax due to various underlying conditions, and tension hemothorax results from massive intrathoracic bleeding causing ipsilateral lung compression and mediastinal displacement. Signs and symptoms: chest pain, especially when breathing, dyspnea, cyanosis, decreased or absent breath sounds on affected side, tracheal deviation to unaffected side, dull resonance on percussion, tachycardia, hypotension, pale, cool, clammy skin, narrowing pulse pressure, feelings of restlessness and anxiety. Contact a medical professional if you have dizziness, lightheadedness, fever and cough, or a feeling of heaviness in chest, severe chest, neck, jaw, shoulder or arm pain, any serious injury to the chest pain, or difficulty breathing and shortness of breath. Diagnosis: people may experience different symptoms depending on the progression of the hemothorax. Diagnosing hemothorax may involve both a physical examination and an imaging test. During a physical exam, doctors will listen for sounds of abnormal breathing with a stethoscope, and if the person has hemothorax, doctor may notice decreased or absent breath sounds on the affected side. Other methods of diagnosis include chest X-ray, ultrasound, CT scan, analysis of the pleural fluid, thoracentesis, and thoracostomy. Treatment: the goal of treatment involves stabilizing the patient, stop the bleeding, and removing the blood in the pleural space. The doctor will monitor the person's vital signs including oxygen saturation, breathing, heart rate, and blood pressure. A chest tube known as thoracostomy tube is inserted through the chest wall between the ribs to drain the blood and air that has gotten into the pleural cavity. It is left in place and attached to suction for several days to expand the lung. Doctors use a chest tube to create negative pressure in the chest cavity and allow re-expansion of the lung. After the tube thoracostomy has been performed, a chest X-ray should be repeated in order to identify the position of the chest tube, to reveal other intrathoracic pathology, and to confirm whether the collection of blood within the pleural cavity has been fully drained. If a chest tube alone does not control the bleeding, surgery may be needed to stop the bleeding. The person may receive breathing support if needed. Possible complications may include lung problems, fibrosis, pneumonia, infection in the lung, and retained hemothorax. Retained hemothorax occurs when the blood stays in the pleural cavity too long. The blood may clot and be difficult to remove through a chest tube. This blood can cause pus to build up in the surrounding area, which can lead to an infection. Outlook: Hemothorax is a serious condition that can be life-threatening if left untreated. Prognosis depends on the cause of the hemothorax, the amount of blood loss, and how quickly treatment is given. Anyone who has had chest injury should get checked out for hemothorax. Recovery depends on how well the person responds to treatment and how long it takes the blood to clear out of the pleural space. Thank you.